Hello everyone, and welcome to my speech where I'll be talking about the benefits of euthanasia. Have you ever thought about the idea of euthanasia and its perks and how it relates to the hospital setting? Perhaps have had a loved one, prominently of old age, in a hospital suffering from a terrible or disease or injury. Once in my life, I had a grandfather who died of cancer due to smoking, and the doctors gave us the option of euthanasia, which is the process of injecting a lethal poison or gas into the bloodstream to end the patient's life. The states that consist of euthanasia practices are California, Colorado, DC, Hawaii, Maine, Montana, New Jersey, Oregon, Vermont, and Washington, all who have legalized physician-assisted suicide. States such as these have been accepting how beneficial euthanasia is, especially to the patients that are actually enduring these infectious diseases and injuries. In today's speech, I will explain the effects and benefits towards euthanasia and why it should be accepted throughout the country. In this speech, I will describe to you why euthanasia is super effective when it comes to ending the pain and suffering of a patient who are enduring an incurable disease. Second, I will be discussing how medicine and medical practices have evolved over the years. And lastly, I will mention what the doctor's point of view on euthanasia and how it is more prominent. Medical practices such as euthanasia is used as a tool for patients who do not want to live out the rest of their years in their deathbed. So why do people choose this form of death over any other? Euthanasia is a safe and non-painful process that ensures the death of a patient calmly and peacefully. Euthanasia and medical-assisted suicide has come a long way, but also developed a lot of controversy in our day. The majority of people believe that euthanasia should only be the patient's decision and not have other contributors such as the doctors or family members. Based on the long past of euthanasia, it has been faced with many ethical issues and disagreements among the common folk. Euthanasia has been around since the 5th century in BC. The properties within physician-assisted suicide include safe and non-painful treatment to end either a pet or a patient's life. By using medical evaluation, doctors agree that the issue concerning assisted suicide is immense and requires a lot of care. Using this process of euthanasia can help prevent sad emotions from the patient's family. Doctors themselves have a hard time conducting this operation, especially in front of family members. More insight on this topic comes from the journal article called Physicians' Experience with Euthanasia, and this came from a cross-sectional survey, and it explains why it's so hard for doctors to do this. The duty to preserve life on one hand, and the duty to relieve suffering on the other. Euthanasia is an option to those who see that it is necessary to end someone's suffering. In most cases, doctors and physicians will often be tasked with operating with the patient with euthanasia. Some doctors will have their own thoughts on this issue, but it does not change the fact that some states have legalized euthanasia. In most cases, euthanasia is mainly done on pets or animals that are sick or cannot walk, and the elderly as well. Ethics and religion play a large role within the controversy concerning euthanasia. According to the ethics guide from the BBC, it states most religions disapprove of euthanasia. Some of them absolutely forbid it. The Roman Catholic Church, for example, is one of the most active organizations in opposing euthanasia. In addition, I do hope that this speech gave you more knowledge about euthanasia and medical-assisted suicide. I'm very glad that I was able to share my thoughts and opinions on the effects of euthanasia, the benefits it shares, and in future generations we can adapt to a much more advanced medicine to hopefully treat them for the rest of their years. This speech should now justify euthanasia and that it is a process that can help a patient and not cause them any harm or pain. Other medical practices can also be used to help treat injured and sick, and lastly, the physicians also feel restraint when carrying on an operation of euthanasia, which describes the religious aspect of assisted suicide. Even though euthanasia is a considerable practice that should be legal, it does have downsides, such as ethics and morality. We should take it seriously as any other medical treatment to patients, because what it comes down to is to how the patient should feel and what they should decide in the end. Thank you.